Is it live? I don't know.
Yeah.
It's spinning.
Yes, it's live.
Okay. Hi! Well, it's spinning down there. It's thinking. See, now it looks like, I don't know.
Well, maybe we weren't live before. I thought that we were.
I don't know.
It looked like it was. Oh, well.
Hello! I'm tired.
Me too.
I woke up this morning and looked like I hadn't slept in years. I don't know why.
Yeah. See, I always wonder, like, especially right before a vacation, it always feels like the time just drags. And this week, we're only here 3 days, but I feel like this week is taking forever. And I'm sure it's just because it's like a vacation. Yeah. So for those of you that don't know, we are closed tomorrow. And we're always closed
Shocking.
on Friday and Saturday. Well, I had a couple of people want to come in tomorrow. And I'm like, yeah.
That's
at
weird.
least two.
That's
And I'm like, we're actually closed tomorrow for Thanksgiving.
Yeah. It's a national holiday.
Yeah.
Like, a lot of places are closed. I don't know.
And then we're closed every Friday and Saturday.
Yeah.
Which some people still don't know, I guess. But
we have kept it a secret.
Yeah.
It's been a big secret.
I got a secret. Oh, do you have a song for today?
I do, and I didn't tell you what it was, and I'm so excited.
It's the little
I'm a
things.
little worried because I didn't actually preview it, and technically it's explicit, but I don't think that the part that we're going to listen to is.
Well, what if it is?
And I'm sorry.
Oh, no.
I don't think, from what I remember, the beginning part is not. I'm just going to be ready to hit the pause.
Step out for a minute and listen to it?
I think it'll be okay.
Okay, we'll just go for it. No one's watching right now anyway, so it's fine. Is that as loud as it goes? Can people hear it?
Oh, yes. I'll turn it off before it gets explicit.
Those are some good moves, though.
Uh-huh. Those are some new moves.
Yeah?
Yeah. Do you remember that song?
Oh, we have one person.
Whatever.
How exciting.
Well, it's because they like my song.
Well, they probably just missed your song.
Oh, well,
and now they're going to have to go back
I'll
to
have
the
to go
beginning
back.
after
That's
we're done. Yeah, that was good.
Worth it.
That was pretty good.
Get it? Because it's hip. Because we're talking about hips.
Yes,
and
I got
knees.
it. Why are you so excited? You have a sparkle on your
I
eye.
have sparkles everywhere. I started putting up the Christmas tree here today. I have sparkles on my hands. I have sparkles on my clothes.
On your face.
On my face.
Yeah.
Yeah. That's what Christmas is like in my house and here.
Yeah.
I did my best to clean it up off the floor. Glitter is permanent.
No, we're going to find it like
For
you know,
years.
for the next
years
year.
and years.
We'll find more. It's like Christmas threw up in here, and I really enjoy it.
Crystal wanted me to put up the tree
I
today.
did.
I was going to wait until after Thanksgiving, like a good, normal person. I mean, not at my house.
I
My
was
house
going to
is
say,
so
don't act like that.
Well, no, I'm not going to lie. My house is, like, full of Christmas right now.
Yeah.
Yeah, it's not done, but it'll probably be done this weekend. That's my plan, is Saturday to put up the outside lights. But, yeah.
I mean, she has to come to my house this weekend and put up my Christmas tree.
Well,
which
I
I'm
didn't
really
promise
excited
that it was
about.
going to be this weekend, though.
Okay, well, in the next 2 weeks, she's going to come to my house and put up my Christmas tree. Because I hate I love looking at a tree, but I hate putting them up.
It's so weird. It's so
Yeah.
weird. I love it. Makes me so happy. So much fun. So let's talk about some hips.
Okay.
When I dip, you dip, we dip.
Oh,
So we did some hip x-rays. What day is it? It's Wednesday. We did them yesterday. Mm-hmm.
Are you talking about for Jace?
Mm-hmm.
Yeah, one of my dogs.
Yeah, so not because there's anything wrong with them, but because it's nice to have some normal x-rays to show, because it can be difficult to describe, what the difference is between normal and abnormal on an x-ray. So it's nice to be able to have things that we can set side by side and show people. So Jace was here to get his teeth done. And so while he was sleeping, we got some hip x-rays on him as well. So he has some beautiful hips. They're gorgeous.
Gorgeous. Which makes me really happy.
No, I don't know. Maybe, hopefully you can see it. So those are good hips.
You want me to hold it
so
you can,
yeah, I got scooch up. So I'm gonna try not. This is gonna be difficult. So hip 1, hip 2. There we go. This is backwards. This is hard. So what we like to see in the hip joint. So the hip joint is the femur or the thigh bone, and where it hooks into the pelvis. And so you have the socket, and it's a ball and socket joint. So it moves around like that, right?
Beautiful. Yep.
Gorgeous. So what we like to see is just like what we have here, where we have nice even distance between the head of the femur and that cup, that joint. It's called the acetabulum on the femur or on the pelvis. And so it's nice and even, kind of all the way around that head of that femur, and it's got really good coverage of the femoral head. So what we'll see, let's see, which direction do I go? Nose or knees? Oh, we'll show baby Hanky's x-rays. Whereas this is my dog. This is Henry Wrinkler. So you can see we weren't necessarily shooting for hips. We just happened to catch them on the edge of an x-ray, so that's why they're not like centered on there. But see this one, basically what's happening with those, like lined up, is his joint is like this. And so we don't have good coverage, so guess what happens? Then that moves around, and we start seeing extra bone production, which he's got a little bit like here, because the body's trying to stabilize that joint. And the way that it does that is it puts more bone in there. That's not really effective, but that's what it does. And so this is hip dysplasia. So this is something that you can put it down, I think.
Okay.
Yeah, you did such a good job though, like Vanna White. So it was a combination of factors that caused that in him, most likely. Genetics play a big role in it, which is why anybody that's planning to breed, especially large breed dogs, they need to be OFA certified. What is that? Do you know what OFA is?
I don't remember the abbreviation.
Orthopedic Foundation of
There you go. Isn't it basically where they just make sure that their hips are good so that that's a trait that passes on,
right?
And they're not going to end up with hip dysplasia.
Yeah. So because there is a strong genetic component to hip dysplasia, making sure that both of the parents' hips are good from the start makes it more likely that the puppy's hips are going to be good. It's not a guarantee, but it makes it more likely. And so making sure that, so they get x-rays done, they get some doctor or radiologist who certifies them, and they classify them as like good or poor or fair or whatever. And so obviously you would not want to breed anything that would be fair or poor, and even ideally good is maybe questionable, because I think there's an excellent, I think is the best one.
So you have to wait until they're like 2 years old before you can do that?
Yeah, so you can get a preliminary done younger, but to really be officially OFA certified, they have to be 2 years old. And that has to do with closure of growth plates and things like that in the development. So they want to make sure that they truly are good. So genetics is one reason. And he's just a little mixed thing.
Little baby manatee.
Yeah, my little baby manatee. Yeah, he's, I think his DNA test came back like Staffordshire Terrier, and then just like a whole bunch of other random breeds. So, I mean,
really cute.
obviously it's just, his genetics are all over the place. So there's that. But then also, there's things as far as nutrition and development and injuries and things like that can happen as they grow up. They can contribute to bad hips as well. So it's a combination of both, although I think genetics do tend to play a bigger role in things. So very, very important if you are getting a puppy from a breeder, make sure those parents are OFA certified.
Yes,
that's
true.
right. That is true,
Jessica.
Jessica. Yeah, absolutely. All responsible breeders do appropriate genetic testing and OFA certification. And there's hips, there's elbows, there's all kinds of stuff that OFA certifies. And that just depends on what breed you're looking at and what they're going to be prone to. Yes, there's a cost involved, but again, responsible breeders understand that and are actually working towards, improving the breed, not just cranking out puppies. So, an important thing. So, if you have a breeder, if you're trying to decide between two breeders and one of them does the certifications and the other one doesn't, it would be worth it to pay a little bit more for that puppy to come from a breeder that's doing it responsibly.
Because hip dysplasia, it's not fun for anyone.
No.
It was one of my ex's dogs. She had really bad hip dysplasia. Do you remember Abby?
Mm-hmm.
We actually did an FHO on her, which is a femoral head osteotomy or osteoectomy.
Do we have a picture so you can show? I'll hold it up for you.
Sure.
And you can show what that is.
Sure.
I'll be your Vanna White.
Okay. You're putting me on the spot now.
I'll make it big.
So basically, correct me if I'm wrong, they take...
Can you see it good that way?
Yeah,
okay.
Yeah. They take and they cut somewhere here.
Yep.
And they just pop this part of the bone out.
Mm-hmm.
And then the muscle and everything kind of holds that in place.
Mm-hmm.
So that it's not rubbing on the acetabulum, like this part.
Mm-hmm.
So it's not causing them pain or discomfort anymore.
Right.
And it's a pretty big surgery. I mean, she was down for a couple weeks. But after that, I mean, she felt much better. She did walk a little funny in the back just because, they don't...
part of that bone.
Yeah,
I mean,
they don't
it's never
have that.
Normal.
But it helped a lot with her pain.
Yeah, so it's kind of like a salvage type procedure where we're just trying to get them to be pain-free.
Mm-hmm.
So, definitely not ideal. And they do total hip replacements in animals. That is an option as well. Obviously, there's a huge price difference there, and not everybody can afford total hip replacements.
Mm-hmm.
I told Jason he better start saving up, though. My little hanky man, he's got his hips done.
How old is he?
He's 3.
Yeah. I mean, Jace, the one we did x-rays of my dog, he's almost 11.
Mm-hmm.
And you can tell it doesn't have to be age specific.
Yeah.
Henry's looked awful, and
awful.
He's 3. And
yeah.
Thank goodness, my dog, he's almost 11, and his look great.
Yeah.
So
hip dysplasia is funky, really bad stuff. We had a lab that had horrific hip dysplasia as well. Always ask to meet the parents of your puppy. Yeah, for sure. Absolutely. And they should be able to provide you, if they have them certified or there's genetic testing done, you should be able to see all that.
Mm-hmm.
They should be able to provide that. Don't just take their word for it, because unfortunately there are not good breeders in the world who will happily lie to you. So hips are a big thing with especially the large breed animals. Small breeds can have hip issues as well. Hip dysplasia, it's just a lot less common. They tend to have other issues.
Their knees.
They tend to have knee problems. But big dogs have knee problems too, just in a different way. So anything else but hips, hip dysplasia? So really the only way to diagnose hip dysplasia is with an x-ray. There's signs that we can see on a physical exam that can kind of lead us down that road, but ultimately it's going to require an x-ray to know for sure.
Mm-hmm.
And I think a lot of people think that anything that's limping in a back leg, it's their hips.
Most of the time.
Most of the time, it's not. I think it's more common that we see knee problems. So let's talk about.
I was going to say, hips. They can also have arthritis there.
Oh yeah.
So that
for sure.
You have a picture of that?
No.
Oh.
I was just getting prepared to talk about knees.
Oh. Okay.
Yeah. Because we talked about arthritis before and that sort of thing. Actually, let me see. Do I have a picture? Oh, this one actually does have a picture of arthritis. I lied. Ha! Look at me go. Look at me be prepared.
Yeah. Let me hold it again.
So, yeah, I'm getting a glare as well. I'm trying to avoid the glare. So this is, again, hips. We have both of these, this one's got extra bone being put in there and there. So the body's trying to stabilize that, and that's what arthritis basically is. So we're getting inflammation in that joint. Same thing over here. We've got some extra bone production there and there on both the head of the femur and on that socket, that acetabulum. So there's extra bone being put in there. There's inflammation that's there. That's what osteoarthritis is. So that is, yeah, that's wicked. Those hips are even worse than Henry's. Poor thing. But yeah, so that is a consequence of hip dysplasia or just age. So those are things that we look for as well. Yeah. So let's talk about some knees. Let's talk about big dog knees.
Okay.
Because I have pictures of those. I don't have pictures of little dog knees because we don't usually see it in a picture. So let's talk about where the knee is. I should have pulled up a picture of an animal.
Where the knee is. I'm
not
sure what you mean by
that. Like where is the knee on a dog or a cat?
The part where it bends.
Wow.
On their back leg.
Yeah, but bends which way? You act like this is like something people know, but they don't.
I mean, I'm confused though.
Yeah. Why?
Because I don't know what you're asking.
Here, let me. Since we have props today, you just talk amongst yourselves.
Okay.
I'll give you a topic. You don't understand that. She doesn't know that one either.
Eater? I don't eater.
It's an either. Gosh.
If anyone has questions, I say this almost every video, and no one ever has
Nobody
questions.
has questions.
But if anyone has questions, let me know. Or, you want to talk to me while she's busy.
If you want to talk to me. Okay. So here is, look, it's a dog.
It is a dog. Yeah, look at
We
that.
can all agree on that.
Yeah.
All right. So this is really hard to do backwards. Okay. So front legs, back legs. Good?
Yes.
I think we're all in agreement with that.
Yes.
Shoulder is up here. Elbow, wrist. Hips, knee. This would be more like their ankle. Oh,
there we go.
I'll do it again. Hips are up high. Knee is like right here. And then this would be like their ankle. We call it their hock. But yeah, so basically their front legs are like our arms and their back legs are like our legs and how we name the things. So they don't have a front knee. They have an elbow. God love them. Because people don't know.
Yeah,
they don't
that's
know.
True.
You know, so, just some basic anatomy. So we're going to talk about knees in the back legs. Stifle joint.
Head, shoulders, knees, and
We could have done that one. We could have done that song today.
Yeah.
But yeah, so the knee. So things that happen very commonly in big dogs. What do we see?
Cruciate tears.
What is that?
In humans, it's what the ACL tear.
The anterior cruciate ligament.
Call it the CCL.
Mm-hmm. And that just has to do with different directional terms. We're getting a message from the outside world. Do you need to go talk to your husband?
Yeah, but they don't have it filled for either. Okay, I'll be right back.
Okay, you come right back.
I'm sorry.
It's okay. Crystal's having a emergency situation at home, but everybody's fine. So knees wise, let me pull up the x-ray. So this is an x-ray of a knee. So we have here, the kneecap is this littler bone here. This big bone from the top is the femur or the thigh bone. And then this one here is the lower leg bone. It's the tibia and the fibula. So in big dogs, what we see is the cruciate tears. So the cruciate is a ligament that lives between the thigh bone and the lower leg bone, between the femur and the tibia. So those bones are kind of set up like this, and those ligaments, there's actually two there that are in an X shape that are holding those bones together. And what those ligaments do is they keep the bones from moving around like this. So What happens if one of them tears? That means that the bones are having abnormal movements, and that's where a lot of the discomfort comes from. They also get swelling in that joint, and then because of that, they're set up for arthritis in that joint. So no good. Anybody that's had an ACL tear, I'm sure, knows that it is not comfortable. It's not fun. And people, I honestly don't know what surgery they do in people. I'm under the impression that they may do some kind of ligament repair, but that is not what happens in animals. So in animals, we do a couple, I'm just talking to myself.
I'm back.
In animals, we do a couple of different surgeries that are possible depending on the size of the pet. The most common one that we see, because again, this is usually a big dog problem, although it can happen in small dogs. It's more common in the big guys like the labs, the pitties, boxers, those big, like, muscly sort of guys.
That kind of walk straight-legged.
Well, especially, if you walk straight, and the ones where they're putting, like, a lot of extra strain, like, they're doing a lot of, like, sliding, twisting, running after the tennis ball, and, things like that.
Mm-hmm.
So the most common surgery that's done in those big guys is this. It is called a TPLO. So there is a cut in the tibia, and the top portion of it is rotated. So again, tibia here. So they've made an incision into the bone itself, a little curved incision, and then rotated it and then plated it in place. The reason for that is to adjust the angle of the top of that bone to try to prevent some of that abnormal movement and stabilize the joint. So, not a cheap surgery.
No.
Not a surgery that we do here. That's a specialist surgery as well, just like a total hip replacement would be a specialist surgery. So yeah, I think those are somewhere in the realm of like $2,500, $3,000, maybe plus.
Per knee.
Per knee. Yeah. And that's a good point, because they will tell you something like 90+% of the time, if they tear one ligament in one knee, they're going to tear the other in the other leg. Do you know why?
Because they're prone to it. And I guess they're putting more strain on the other knee, which they're probably also walking all straight and crookedy. And
yeah, so a lot of the times with these cruciate tears, there was already a degenerative process happening, meaning that over time, and for a variety of reasons, a lot of times it's genetic, again, they're having breakdown of the ligament. It's wearing down. And so then what'll happen is just all of a sudden, any little thing, could be walking down a step, could be stepping in a hole, could be, anything that normally shouldn't cause these issues, it'll just snap because it's just that weak. So it'll tear, and then we start seeing that they're limping and they're holding the leg up or their toe touching, and that hurts. That's not fun. So that's why a lot of the times, because it's a degenerative process that has started happening, it's also happening in the other leg. So the weakening of that ligament combined with, like you said, the additional strain, because they were holding up one leg to the other, putting all their weight on the other one, that's going to make it a lot more likely that they tear the other one.
Yeah.
And it's usually within a year or two.
Yeah. Of course, one of mine at home has 2 torn cruciates, but she's ancient.
Of course she does, yeah.
Yeah, she'll be a 14-year-old pit bull in March. And yeah, she tore one, and within the year, she tore the other one.
Yeah.
And at her age, surgery wasn't really, it's not that it wasn't an option, it wasn't really feasible. It didn't make sense to us.
Yeah.
So we just medically managed.
Yeah, and so a lot of times we'll start off with medical management because we don't have any way to tell on an x-ray if it's a partial or a complete tear. They can get just partial tears of their cruciates. And so, maybe with rust and that, the body kind of scars it in and it's good. That joint's never going to be normal, whether they have surgery or not. But if we can give them some time, give them some rest, sometimes that inflammation comes down enough that the body stabilizes that joint itself. Usually we know within a few weeks if that's going to happen. And, you know, at that point, if we're not noticing any improvement, surgery is probably our best bet. So, you know, time to start considering or scheduling that appointment. And I know not everybody can do surgery because it's pricey.
Yeah.
It is. And so, yeah, that's why a lot of the times we end up trying medical management first. Although theoretically pursuing surgery sooner rather than later is a good thing. So if you think that you are even interested in it at all, you know, it's probably one of those things where we do the x-rays, we confirm that that's what's going on, and then we just go ahead and get you on the schedule at the specialist. They're usually a couple weeks out anyway. That way you're on the books for your consultations. I don't know if I pulled up, I don't know if I have an x-ray up. Oh, I do. Man, I'm so good.
Look at you.
So, what's happening? How do we diagnose a cruciate tear? I said that we do x-rays, but that we can't see if it's a partial or complete tear. That's because we technically cannot see the ligament on the x-ray. It's soft tissue, we can't see it. It blends in with the skin and with the muscles, and you can't really tell. So instead, what we're looking for is some other changes. So this is a picture. You want to hold it again?
I will.
Yep. Okay. So this is a picture of a dog with probably a cruciate tear. So there's a couple of things that are happening here. The biggest issue is that there is swelling in that joint. And how do I know that? So one, this little dark line is a space between some muscles. Normally that should be running really up close to the back of that tibia there. So you can see that there's a gap. So it tells me that that is being pushed that way. Same thing up here. So there's a fat pad in the front of the knee. I don't know how well my fat finger's probably gonna be in the way. So there's like a little triangle here where it's darker in the front, lighter towards the bones. That darker area should come in much more than what it does. And so, again, swelling in the joint is pushing that little fat pad forward. So basically, we're swelling in the joint, it's going whoop. And so we can see that haziness. It's the sound it makes. So we can see that haziness that's there. So that's what's telling us that there's something going on there. We can also see extra bone production here on this guy. And on this little bone back here, it's called a fibula. There's a little extra bony production. So that joint's all kinds of messed up. That's unhappy. Thank you.
Technical term. All kinds of messed up.
That ain't right. That's messed up. And so, yeah, so that would be one that we would diagnose with a cruciate tear. Because really that's about the only thing that happens in those joints that causes that appearance. So even though we can't see the ligaments themselves, we see all that evidence of what's happening, and that tells us.
Isn't she so smart, you guys? She's just the smartest.
I would never claim that. Good Lord.
I told her yesterday I'm just going to
Sad.
siphon all of her smartness into myself. Does that sound weird? Maybe that was
a little
weird.
creepy.
Okay.
So both of these conditions, so whether we're talking about cruciates or hip dysplasia, a lot of times what we do treatment-wise, again, we talk about surgery and what options there are, things like that, but medical management-wise, joint supplements, which we've talked about, and anti-inflammatories as well. And so that'll help bring down swelling in the joint, make it more comfortable. We may do some additional pain control if we need to. There's cold laser therapy that can be done that helps with swelling and inflammation in those joints. All those things together. Sometimes there's different like rehab things that can be done as well. Underwater treadmills and things to try to build up muscle. That's more kind of like on the back side of things. With the immediate, you know, it just happened or they're just now painful from it, we're usually doing anti-inflammatories with or without other pain meds and joint supplements.
And joint supplements you can do anytime. They're
Oh,
wonderful to start
Yeah.
anytime. It doesn't have to be like, oh, my dog blew a cruciate.
Mm-hmm.
Now we're starting the joint supplements. You can do that anytime.
Right. I like, you know, I mean, Henry's not painful in his hips, so he doesn't care. He
No.
zooms around like a goofball.
And he walks.
Yeah.
Butt
He walks
swinging.
like a supermodel. But he's, you know, he doesn't show any signs of discomfort at all, but I've already started him on joint supplements, just trying to keep those hips as healthy as possible for as long as possible and keep his other joints healthier. Because I know that at some point in his future, he's probably going to need hip surgery in some way, shape, or form. Depends on who you ask. I say total hip replacement. My husband might not agree.
Does he get a say, though?
No.
Yeah, I didn't think so.
No. So, what else? Anything else?
Were we going to talk about little dog problems?
We could take like 2 minutes to talk about what happens in little dog knees. So little dogs get what's called luxating patellas. Typically, it's a medial luxating patella. What is that, Crystal?
Moving to the inside.
What is?
Popping out. Their
What is
kneecap.
Their kneecap.
Their kneecap.
Mm-hmm.
Popping out of place.
Why?
And then they may walk a little funny. What, is it because that ligament, it's not strong enough? I have no idea. I don't know why they pop out.
That's fair.
I'm going to say, I don't know. I can come up with a good, reasonable, like in my head, what makes sense. But
what makes sense in your head?
That maybe the ligament's not strong enough to keep it in place.
Okay, so that's what, not necessarily like not strong enough, but it's like, it's just not holding as tightly. So the patella, also known as the kneecap, lives in a groove, and I like to show it like with my knuckles. So like this. So this would be the kneecap. And this is the groove on the top of the femur. What? You don't like my little action?
I love it.
So normally it glides like this, right? Cool. As they bend their knee, it's sliding, it's doing its thing. That's great. And then there's straps of like muscles and ligaments and things holding it down into that groove. So either what's holding it down is not tight enough, or this groove is too shallow. So if that groove is very flat, like the top of my hand, like we can just go wherever. So it doesn't matter how tight something's holding it down, it's still able to, because there's nothing for it to hold down into. So that is the luxating patella. So that's something that we see very commonly in small breed dogs. They're usually born with it. It can happen traumatically if there's damage to the tendons, ligaments that are holding their strap and that little kneecap down. But usually it's something that they're born with. Most of the time it doesn't cause them a whole lot of issues unless it's a really bad one. What?
It happened again in this episode. Maybe she's born with it. Maybe it's me.
You're so weird. So it usually doesn't cause a problem. Sometimes you may notice that like they're walking or they're running along and then they like kind of kick that back leg out funny. And it's because that kneecap probably slid out of place, and then as they straighten their leg out, it'll like kind of snap back in. But real severe ones, sometimes they just, like their kneecap lives on the inside of their knee all the time. That's funky.
I think it's funny though, you can tell like the ones that know like what to do to fix it.
Yep.
It's really funny.
They can usually feel that. They can fix it. Now there's surgery that can be done for the real severe ones. That's something that I would suggest. Surgery that can be done to deepen the groove and tighten up those tendons, those ligaments and everything, to keep it strapped on in there. But yeah, most of them, we don't do anything unless it's causing them discomfort. But just something to note, like if you have a little dog that will be running along, kicks that back leg out, that's probably what's happening. His kneecap probably slid out of place. And nothing to freak out about. It just is.
Yeah.
It's okay.
Most of the time they don't care.
No. Ruger, so one of my dogs, because when you have 5 million dogs, they have all the things. So Ruger,
between the two of us, one of us will have one of these issues.
So he's one of my bully breed mixes. He's like 50 pounds, but he has a kneecap that slides in and out.
He does?
It freaks me out, because I'll feel it. Sometimes like he'll move and you can feel like the pop, and that freaks me out, but he doesn't care.
I had no idea.
He's fine. He doesn't care. Yeah, I never changed it. He doesn't like kick his leg out or do anything. I just notice it like as he moves, like when he's adjusting, when he's laying down, because he's a couch potato. So that's it. Yeah. So I think that's all we have time for.
Yeah. I agree.
We didn't talk fast enough.
Maybe we just talked too much in the beginning.
Or that. Yeah.
About our Christmas decorations.
Oh, that's okay. But yeah, if there's something that we didn't cover, you have questions about it, leave us a comment, let us know. Otherwise, we will not see you tomorrow because we will not be here, but we'll be back on Sunday. So give us a call if you need anything, and do not give your pets things from your Thanksgiving dinner.
No.
we don't want a full day of like vomiting and diarrhea on Sunday.
No.
We don't want to see that.
No bones.
No bones.
Don't give them any onions.
Just don't give them
garlic.
anything. They don't need anything. They're fine.
Give them like a little milk bone as a
There
treat.
you go. Yeah.
Yeah.
That's it. That's all they need. So, all right. Have a wonderful afternoon, everyone.
See you next
Happy
week.
Thanksgiving.